Hello everybody, welcome to the second lecture of this Unit 5 of Module 5, Narrative Medicine. This lecture will focus on the implications that literature can have for the improvement of clinical practice, with a particular focus on the integration of spirituality in healthcare settings. Following this aim, the lecture reviews examples from the classic literature and emphasizes possible links to the inclusion of spirituality as an integral part of treatment in clinical cases. The field of spirituality and medicine has experienced a significant growth in recent years, largely due to the development of curricula in many US universities since the 70s, and to residency trainee programs and research centers. This inclusion of spirituality within the curricula and training of health professionals coincides with the opening of the field of medicine to disciplines and knowledge other than the strictly biomedical, especially the inclusion of the humanities or literary studies. However, despite attempts to extend the field of medicine to other disciplines, there is still no specific space in this broad field of spirituality where the literature on spirituality is reflected in its significant contributions to medical practice. We could affirm that the foundation of most religions and an important part of the different conception of spirituality is to be found what we know as sacred texts, sacred books, or sacred scripture, which for many scholars even constitute a literary genre. Bible, the Quran, Tanakh, the Upanishad, or the Popol Vuh are some of the sacred books of some religions or spiritual visions within the world. They offer the main worldviews and mythologies, but they may also contain guidance that can offer some answers to fundamental questions about spirituality, suffering, pain, or meaning. While these texts do not espouse the unique view of spirituality, we believe it is important to take them into account when offering a look of spirituality and literature. As we have already mentioned, the universe of literature and spirituality had not been much explored in academic research. One of the works that had explored the intersection between literature, spirituality, and medicine is that developed by Nancy Berlinger. After a review of the situation of spirituality and its inclusion in recent years in different medical programs, attempting to review the different conceptualization that spirituality has had for the field of medicine. The TED concludes with several case studies of the diagnosis of religious consciousness in medical literature and in literary texts, with special attention to ethical concepts. Religious consciousness, or rather a high excess of spirituality, has been treated by some scholars as a symptom or illness or insanity, without avenues or further explorations. One of the literary texts Berlinger approaches is Fyodor Dostoevsky's novel The Idiot, where Prince Miskin is diagnosed through his spirituality. This excess of spirituality will have something to do with temporal lobe epilepsy, with a heightened religious awareness being understood as the hallmark of this disorder. In a more modern novel, Lying Awake, by Mark Saltman, the author finds a similar treatment of spirituality as in the novel of The Idiot. This text tells the story of a cloister nun, Sister Joan of the Cross, whose vision of good, which she translates into poetry, are diagnosed as temporal lobe epilepsy caused by a tumor. The disease is treatable. If the tumor is removed, the vision caused by the neurological problem will disappear. The novel mentions another examples of a diagnosis of temporal lobe epilepsy based on this model. St. Paul, Santa Teresa of Avila, Van Gogh. The author concludes that there is an interesting medical literature devoted to the retroactive diagnosis of this disease in people described in literary and historical texts. Many of these case studies involve accounts of or about religious figures, the Prophet Muhammad, the Prophet Ezekiel, or Joan of Arc. These studies offer some insight into how religiosity or spirituality as a form of religious spirituality have been viewed by clinical research. An example of the usefulness of literature and spirituality is the case described by Tim Harlow. In his TED, he reflects, among others, the personal story of how the power of literature was taught to him through a medical student, Jay, a devout Christian whose faith is central to the person he is and to his work. Jay had a series of difficult cases and was involved in the death of patients, one of whom committed suicide. At times he felt despondent, finding himself in what seems like a truly dark night of the soul, until he discovered the poem Footprints in the Sand and found it surprisingly useful for the development of his work. Jay felt that he had become so focused on learning the fact of medicine that his own well-being had taken a backseat. Realizing how useful literature could be, Jay changed his opinion about studying other areas outside of medicine. As Tim Harlow points out, religious and spirituality literature is relevant primarily to its adherents and to those who find their cultural expression in a religion, who are also better places to judge its value to them as practitioners. For those who have no religious affiliation, it must also be recognized that it provides a lens for many people to see the world. Literature can help human beings who are patients, but also those who have medical road. This is the end of lecture 2. See you in the next lecture.